You're the leading infectious disease person in the United States, maybe the world. How many times a day do you wash your hands?
I would say at least 6, 7, 8, 9 times a day.
Is there any evidence that being vaccinated causes these diseases?
The answer is absolutely not.
President George W. Bush asked you what you could do about HIV and AIDS in Africa.
He felt that as a rich nation, we have a moral responsibility.
The best way for me to prevent getting an infectious disease and having to have you as my doctor is what?
The normal, low-tech, healthy things are the best thing that you can do, David, is stay healthy.
Would you fix your tie, please?
Well, people wouldn't recognize me if my tie was fixed, but okay. Just leave it this way. All right. I don't consider myself a journalist, and nobody else would consider myself a journalist. I began to take on the life of being an interviewer, even though I have a day job running a private equity firm. How do you define leadership? What is it that makes somebody tick? We're here today with Dr. Anthony, also Tony Fauci, who is the director of the Allergy and Infectious Disease Institute of the National Institute for Health, which he has led since 1984, 35 years. That's a pretty long time to be leading an institute at NIH. Is that a record?
It is, indeed. It is.
You haven't gotten tired of doing this after 35 years?
No, because things keep changing. We get new infectious diseases, new outbreaks, new challenges, so it's almost like a different job every year or two.
I'm always worried about getting a flu. So if I want to avoid catching the flu, should I take a flu shot?
Yes, influenza vaccination clearly protects you. It isn't a perfect vaccine. It doesn't protect you 100%, and it varies from year to year. But the best way to avoid influenza is to get your flu shot every year.
Now, do you get one every year?
I do.
I usually don't get them, and I'll tell you why. I'm often afraid that I will get the influenza shot for a different flu than the one that comes out that season. Is that a problem?
Since influenza, almost unique among viruses, tends to drift or change from season to season, that essentially every year you get vaccinated with a vaccine that we hope matches well with the circulating virus. But it's possible that you make a vaccine against one and it'll change a little by the time the season comes, and then it isn't a best match. But it's still always better to get vaccinated.
Now, 100 years ago, around 1918, 1919, about 100 million people in the world were killed by influenza. Why was that? Could they not treat it better than those days?
It was a pandemic, and a pandemic means that it is a virus that no one had any previous experience with. It was a brand new influenza, and it happened to be one that spread very rapidly and that was very virulent. It was a catastrophe.
Something like that not likely to happen again, you think?
Hopefully not as severe as that. We had a pandemic in 2009, H1N1, the swine flu of 2009. It was a pandemic because it was a brand new virus. The good news is that it wasn't particularly virulent, so although it spread rapidly, it didn't kill as many people.
You're the leading infectious disease person in the United States, maybe the world. How many times a day do you wash your hands?
I would say at least 6, 7, 8, 9 times a day.
Does it look bad if you shake somebody's hand, then you go wash your hands right away? That doesn't look good,
if
does
you
it?
make it obvious to the person.
Just don't make it obvious,
That's
right?
That's right, don't make it obvious.
Okay, so you avoid making it obvious.
I avoid embarrassing people, right.
Now, I have a theory that when somebody is ready to cough, they get close to me. So whenever I'm in a movie theater or I'm walking somewhere, as soon as they walk past me, that's when they cough. Or I'm in the movie theater that got bubonic plague right behind me. Do you ever have this problem where people are coughing on you all the time? And what do you say to somebody?
That is very tough. To the extent that you can do it within our social norms, you try, particularly in a flu season in the winter where there's a lot of virus going around, to try and distance yourself. We call that social distancing. Right. But sometimes you get trapped. In the middle of last winter, I was literally trapped on a transatlantic flight with a woman who was doing just that. She was sneezing and coughing, and I couldn't tell her to get out of there. We were sitting next to each other. Sure enough, about 5 days after I got back to D.C., I got sick.
So let's talk about humans in the background and infectious diseases. When humans first came out of caves, more or less, let's say Homo sapiens 300,000 plus years ago, they had an average life expectancy roughly of 20 years old. Today, average life expectancy in the United States is maybe 80 or something like that, where infectious disease is a large part of the problem.
It wasn't only just infectious disease then, it was the issue of survival under very severe environmental circumstances. However, if you look at the 17th, 18th, 19th centuries where there were infectious diseases before the vaccines and antibiotics greatly increased the life expectancy because many children died. And when children die, the average life expectancy goes down.
Now, what was the bubonic plague that went in Europe hundreds of years ago? What was that?
Well, that was a bacteria. It was called either Yersinia pestis or Pasteurella pestis, a bacteria that was spread, interestingly, through fleas that were in situations in which the hygiene wasn't very good. It would bite somebody, they would get infected. There were two types of plague. There was the bubonic plague, where people would get very swollen lymph nodes. They could die from that. They generally don't spread it from person to person. And then there was the pneumonic plague, in which it disseminated through the body and you could cough and transmit it to somebody. It devastated Europe. In the 14th century, 1/3 of the population of Europe died from the plague.
The chance of that happening again is remote.
Well, not with that microbe, because it's easily treatable with an antibiotic.
When did vaccinations first start? I remember reading about in the Revolutionary War period of time, some people would get inoculated against smallpox. How did they do that then? When did people first realize you could be inoculated against a disease?
That was in 1796, and that was Edward Jenner, who noticed a very interesting phenomenon, that smallpox was rampant in society then, and he noticed that the women who were the cow maids, who would be milking the cows, they would get a relatively mild disease called cowpox, which was very much related to smallpox. And he noticed they would get cowpox, they would recover from it, but then they would be immune to smallpox. So he put two and two together and said, if we could deliberately infect people with a version of smallpox, namely cowpox, that they actually would be protected against smallpox. And he actually did an experiment on a young boy, which quite frankly, retrospectively, was an unethical experiment, because he vaccinated the boy with this cowpox and then challenged the boy with smallpox, and he was protected. So that all started at the end of the 18th century.
Now, in the modern era, there has been some concern about vaccination. Some people think it causes diseases, it could cause autism. Is there any evidence that being vaccinated causes these diseases?
No, the answer is absolutely not, and it's unfortunate because there's a lot of misinformation that is being spread widely, leading right now to a diminution in the percentage of parents who vaccinate their children, particularly against measles. And that's why right now, today, as we speak, we're seeing completely avoidable measles outbreaks throughout the country and even throughout the world. There's currently one now in New York City, in the Williamsburg section of Brooklyn, that is really quite alarming.
Let's talk about a few other communicable or infectious diseases. Tuberculosis, is that still a big problem in the United States and around the world?
Less so in the United States, but globally it's still a big problem. I mean, it's a terrible problem. There are 10 million new cases of tuberculosis each year and 1.6 to 1.8 million deaths.
How do you catch tuberculosis?
Predominantly, it's respiratory spread. If you get close and prolonged contact with someone who has TB, that's how it gets transmitted.
What about malaria? How does one get malaria, and how do you prevent getting malaria?
Well, malaria is a parasite that is being transmitted by a mosquito. And you get it by mosquito bite and only by a mosquito bite. Rarely you can get it from being transfused with blood of someone who has malaria, but that's very unusual. Mostly it is a mosquito bite that transmits malaria.
Okay, so you avoid mosquitoes, you're not going to get malaria, right?
Exactly.
President George W. Bush asked you what you could do about HIV and AIDS in Africa.
He felt that as a rich nation, we have a moral responsibility. Can we actually give treatment, care, and prevention? That has saved now about 14 to 15 million lives.
Let's talk about HIV. It originated in humans or not humans?
It started, centuries ago in non-human primates, in chimpanzees, and then it jumped species from the chimpanzees to the human.
Is jumping a species a common thing?
You know, 70 to 75% of all the new infections that man gets infected with come from an animal. It's called zoonotic. Namely, it's predominantly an animal virus, but for one reason or other, encroaching upon the environment of the animal or mutating a bit. Influenza is fundamentally an infection of birds. HIV, we said, came from chimpanzees. A variety of other infections, Zika and other infections, come from an animal.
Now, in Africa, the health abilities that we have in the United States are not prevalent. So HIV and AIDS are still a big problem there.
Right. Well, it is still, we better not downplay it in the United States. There are still about 38,000 to 40,000 new infections in the United States. It is very concentrated both demographically and geographically. It's very interesting that 12% of the population in the United States is African American, and yet about 45 to 50% of all the new infections with HIV among African Americans.
I guess a few years back, when President George W. Bush was president, he asked you to come to the Oval Office and asked you what you could do about HIV and AIDS in Africa. And what did you tell him?
Well, he sent me to Africa to do a fact-finding and come back with the feasibility of doing something, because he said and told me that he felt that as a rich nation, we have a moral responsibility, now that we have drugs that can treat and prevent infection, that others, individuals who, because of where they live, they don't have access to that, and they're essentially going to die from a disease merely because of where they were born and raised, i.e. in the developing world. So he sent me to Africa to figure out, can we actually give treatment, care, and prevention? And we put together a program called the President's Emergency Plan for AIDS Relief, or PEPFAR. And that's probably one of the most important parts of the George W. Bush legacy, because that has saved now about 14 to 15 million lives thus far, and more coming, merely by providing sub-Saharan Africa and other developing countries with the proper drugs that can save their lives as well as prevention.
And who's paying for this, U.S. government?
The U.S. government pays completely for the PEPFAR program, and then we also have the Global Fund to fight AIDS, TB, and malaria, and the U.S. government pays about 1/3 of that.
We're now at the NIH offices, and one of the buildings we're in is the one where some research is done on Ebola.
Correct.
Can you explain what Ebola is,
Right.
why it's so dangerous, and what the problem is right now in the Congo?
Well, indeed, Ebola is yet again another virus. It happens to be a particularly lethal virus. If left untreated, it has a high rate of mortality. You know, depending upon how you get treated or cared for, it can be anywhere from 60 to up to 90%. It's spread by direct contact between an individual who is very sick and has body fluids that are easily contaminating the people who take care of them. It's highly lethal. It is now a major outbreak in the Democratic Republic of the Congo, and it still is not under control.
So when Ebola, some people with Ebola came to the United States a few years ago,
Right.
You were involved in treating them.
Yes, I did. I took care of 2 patients. One was a nurse who got infected in Texas when she was taking care of a person who came from Liberia. I took care of her. And then another person who got infected in Sierra Leone was air evac'd here to the NIH, and my team and I took care of him.
So when you take care of them, I remember pictures, you have to wear like a space astronaut outfit.
It's very difficult because they're very sick. So you have to take care of them under intensive care circumstances. And you have to put on literally a spacesuit to protect every single square inch of your body from being exposed to the contaminating fluids.
You're the head of the division. You're the head of the institute.
Right.
Wouldn't it have been easier to get somebody below you who maybe isn't so valuable to do the work rather than you doing it?
Well, that was the exact reason why I did it, because we all knew that healthcare workers in Africa at the time were getting sick in large numbers and dying. 800 healthcare workers got infected in Africa during that outbreak, and 500 of them died. So I did not like the idea of asking my staff to put themselves at risk of getting infected if I wasn't willing to do it myself.
What did your wife and 3 daughters say about the fact that you were going to be doing this?
They were not happy. My wife, who is, she's an ethicist, but she was also a nurse, so she understands disease. she supported me, but she asked with a quizzical look, do you really want to do that? And I said, I think I really have to do it because it's my team and I didn't want to put them at risk for something that I wasn't willing to do myself.
But the best treatment for Ebola is liquids, just flushing
Right.
out.
It's essentially intensive care. The patient we took care of here at NIH was one of the sickest patients that I've ever treated. I've taken care of thousands
And
of sick
what happened to the
patients.
patient?
He is alive and well and back home right now with
Really?
his family. This is the ugly Ebola. This is what Ebola looks like. It's called filovirus because it's like a thread. Philo, the Latin word for thread. In 1995, there was an outbreak in the Democratic Republic of the Congo in a place called Tikrit there. A person who survived Ebola, this man here, came to the NIH. We took his B cells, we cloned the B cells, and we made what's called a monoclonal antibody, which means that we made his cells produce an antibody in large amounts that actually binds to this glycoprotein right here.
Right.
Now, this monoclonal antibody, as we are speaking, is being tested in the Democratic Republic of the Congo as one of the potential treatments for Ebola.
So if somebody comes up to me and says, I had Ebola, but I'm okay now, is it okay to shake that person's hand?
Oh, yeah. Oh,
It's
yeah.
okay, they're gone, they're safe.
Yeah, well, you may remember when we discharged the young nurse who got infected in Texas, and I discharged her from the NIH. We had a press conference, and I put my arm around her and hugged her, and it made the front page of the Washington Post. And the reason I did that deliberately was to show the rest of the world that when you recover from Ebola, you're
What did your
perfectly
wife
safe.
say?
She thought it was fine.
Okay. All right. Maybe is this something you decided you want to do when you were in medical school or something?
When I was in graduate school, I worked on HIV. And nobody knew much about Ebola then, but I noticed that the glycoprotein that HIV uses had some similarities, we thought, to the glycoprotein that Ebola uses. And so I thought this would be a good opportunity to
Okay.
now make some headway into a new disease that people didn't know much about.
Okay.
And Dr. Fauci gave me that opportunity.
The best way for me to prevent getting an infectious disease and having to have you as my doctor is what? Wearing a mask?
No.
Don't need to do that. If somebody's, I can see they're ready to sneeze or cough, walk away.
You avoid all the paranoid aspects and do
Okay.
something positive. A, good diet. B, you don't smoke, I know. Get good sleep. I think the normal, low-tech, healthy things are the best thing that you can do, David, is stay healthy.
So let's talk about your background. You grew up in Brooklyn,
I did.
and you went to Catholic school.
I went to Catholic Elementary School and Regis High School in Manhattan,
Okay.
and Holy Cross College in Worcester.
And you did you always know you wanted to be a doctor? Or did you think you wanted to be something more important, like a lawyer or private equity investor or something like that?
Well, I can't say I always felt I wanted to be a doctor. I was very interested in the humanities. I took classical background courses, both, that's likely because I went to a Jesuit school, in Greek, Latin, philosophical psychology, all the philosophies. So I had an interest in the humanities, but I also had an aptitude and an interest in science. So I figured the best way to combine an interest in the humanities with an interest in science was to be a physician.
So you first came to NIH in 1968, is that right?
Correct.
So when you were here, there were a lot of other people entering the class with you. Some of them, in fact, many of them have gone on to win Nobel Prizes.
Right.
So Dr. Varmus, among others.
Mike Brown, Joe Goldstein, Bob Lefkowitz, they all won Nobel Prizes.
So how come you haven't won a Nobel Prize yet?
I'm the stupid one in the group. No, actually, my work did not, I probably wouldn't have won one anyway, but my work was much more on broader global health issues. They discovered really exciting, specific things.
But you have won the Presidential Medal of Freedom
I have,
and the Lasker Award.
right, and the
Is
National
there any
Medal of
award
Science,
in medicine that you have not won?
the Nobel Prize.
Okay, that's the only one.
Right.
And well, I'll nominate you if I know how to do that. So let me ask you, you have written more like, I think it's 1,200 articles, co-authored, edited. How do you have time to do 1,200 articles in your career and also run the institute and also treat patients?
Well, one, my career has been quite long, so that's one of the reasons for so many articles. But doing all of that, taking care of patients, running a lab and running a big institute and getting involved in global health policy is, I just explained it, that I work a lot of hours. I'm an unapologetic workaholic, and I really love what I do.
How do you stay in good shape?
Well, I used to run. I used to run marathons and 10Ks. About 2 or 3 years ago, I stopped running every day. I used to run about 6 miles a day, and now I power walk about 3 to 4 miles a day, every day.
And you generally are not sick?
No, I'm generally pretty healthy, thank goodness.
Now,
Yes.
if you do get a little sick and you go to a doctor's office, you're sitting in the office, don't people get nervous? They see you're sitting there?
But they don't get nervous, but it's a good advertisement for the doctor that I go to, because they say, if this guy is going to a doctor, the doctor must be pretty good.
So many people have come to you over the years and said, why don't you leave and go into something maybe more lucrative than doing this? In fact, I came to you once and said, why don't you come into private equity? You can figure out how to be an investor. In the healthcare world, you'd be perfect. You resisted all those entreaties. Why did you do that?
Well, I would have loved to have worked for you, David, but just like everyone else, I felt that I love what I'm doing, and it's so exciting that really is what drives me. So it isn't as if I think those other professions aren't worthy. I just really like what I'm doing. There are still many challenges. We need an HIV vaccine. Tuberculosis and malaria are still major killers, particularly in the developing world. Those are things that I think we have the opportunity to do something about. So I would like to continue to work until I can't work anymore and concentrate on those problems.
So you've worked under many different presidents of the United States. Who was the most impressive of them?
Well, they were all different. So I don't want to be pitting one against the other. I enjoyed very much the Clinton administration, really quite enjoyable working with not only President Clinton, but Hillary Clinton. But the person that was the warmest of them all, that was just an amazing, amazing gentleman, was George H.W. Bush. When he was president, he was the first one that I got to really know as a president. I got to know Reagan a bit, but not much. But George H.W. Bush extended himself to me when he wanted to learn about what HIV was, because he wanted to do something about it.
So as you look back on your career, what would you say are the characteristics that make somebody a leader?
One of the things that I tell people, because I feel it strongly, is that if you're leading an organization of some sort that has a purpose or a mandate, that as the leader, you've got to articulate to the people that you are leading exactly what your vision is and where you want the organization to go. Because I've seen in issues in which there wasn't good leadership, where an organization is almost rudderless. They don't know where they're supposed to be going. You don't dictate to people, but if you let them know what your vision is, hire the best people, and then don't get in their way, that I think is the quality of a good leader.
And let's suppose I get an infectious disease and I want to be one of your patients. How do I get to be one of your patients? Just call you? How does somebody become one of your patients?
You get your doctor to give me a call or send me an email, and if you have a disease that falls under one of the categories that we study, then we'd be happy to see you.
And the best way for me to prevent getting an infectious disease and having to have you as my doctor is what? Wearing a mask?
No.
I don't need to do that. If I can see they're ready to sneeze or cough, walk away.
You avoid all the paranoid aspects and do something positive. A, good diet. B, you don't smoke, I know. I know you don't drink, at least not very much, so that's pretty good. Get some exercise. I know that you don't get as much exercise as you should.
That's correct.
Get good sleep. I think that the normal, low-tech, healthy things are the best thing that you can do, David, is stay healthy.
All right, well, I'm going to try to do that, and hopefully when I next see you, I will be even healthier than I am today.
I would imagine you would be, and I look forward to that.
Thank you very much.
My pleasure.